Hi, Danika, nurse practitioner. Today we're going to discuss dry skin. Disclaimer, this is not medical advice, recommendations, or a diagnosis. This does not take the place of a well child check or sick visit. If you have any questions, please see your healthcare provider or your pediatrician. So now that we are getting into our colder days, I've seen many kids come in with parents concerned with a rough rash that they have. A lot of the times the rash is not visible, but you can absolutely feel it. And then sometimes it is. There's a pinkness to the rash along with the roughness that you feel. Most of the time, here lately especially, it's been episodes of dry skin. I will tell you, this time of year really brings out the dryness with the heaters running in the house, the cold air outside, and then of course our bath water is super warm. Usually it's warm, and we let our kids play in the bath, and there's just all these things that kind of play into having dry skin. So some things that I want to tell you about and maybe educate you on. So during this time of the year, especially, you want to make sure that you're moisturizing your kids really well. You want to make sure what you're putting on their skin is a very wholesome product, and there's not a lot of chemicals in it. So make sure you read your labels and you put wholesome products on them. A good thing, or something that I like to use, is coconut oil. It is super... it's oily, so it provides a barrier and it locks in and brings in that moisture into their skin. So I really like coconut oil. Some other things you can do is make sure that your child doesn't linger in the bathtub. The longer in the warm water, the more dry their skin is going to be. And then when you do get them out, you want to make sure you pat them dry instead of rub them dry. This will also help protect the skin and keep it from flaking. When you are giving your kids a bath, the products that you use are very important. Again, no chemical laden, no fragrance laden if you're trying to help with dry skin. We cannot disregard the fact that a lot of the times dry skin is what we're putting in our body. A lot of the times with, I've seen, especially here lately, a lot of 1-year-olds who have transitioned to whole milk, and all of a sudden they're getting eczema or they have dry skin, and that can absolutely be a factor. Sometimes eczema comes out after as a rash, as eczema, and it's just a sensitivity in your gut. So you also, if your child has never had skin problems before, you also want to look and kind of keep a diary and see what they're putting in their mouth, what they're having to digest, and see if that is maybe probing a rash or a dryness to appear. So super common for skin to be dry at this time of year. However, there are some things that you can do to combat these things. The number one thing I want to remind you is our skin is like a giant mouth. So anything we put on our skin, we absorb, and it's like we're eating it. It's like we're digesting it. So we want to make sure that we're nourishing ourselves with really wholesome products and not anything that's super chemical laden or fragrance laden. Again, if you have any questions or you need any recommendations, please see your healthcare provider. You can always reach out to me, and you'll have a good day.